I want to talk about the cashier section. At the cashier section, you can see all these links. The consultation and registration fees is the fee the patient pays before they see the doctor, as the consultation fee has to be paid before they see the doctor, and then when the patient is registered for the first time in the hospital, there may be some registration fees to be applied. This is where you go as the cashier to do the transaction. Without the patient paying for the consultation fees, the doctor may not be able to see the name on the system. That's how the system is built. So the consultation fees have to be paid first before the doctor can consult with the patient. This is especially for cash patients. For some insurances, the patient doesn't have to pay for anything, in which case the system is set up so that they don't have to pay for the consultation fee, depending on the insurance scheme that they are using and the insurance scheme that was entered on the system whilst they were being registered. The pharmacy bill, this is where you go when the patient wants to pay for their pharmacy bills. This is the lab bill. The lab bills is where you go if they have lab bills to pay. There's also the procedure bills. In case they had some procedure done, the bill will be at this section. These procedures include suturing, maybe some extraction of tooth or passage of a catheter, etc. These procedures will be paid for at this section. Nurse's billing sheet. This is the billing sheet that we normally use in the hospital. The nurses normally indicate some extra costs that the patient has incurred on the ward. So as the cashier, you can go here to do the transaction for that. There's the grand total bill. The grand total bill is a summation of all the other bills. That's the pharmacy bill, the lab bill, the procedure bill, the nurse's billing sheet. It's all in the grand total bill. So if you don't want to go through the whole thing one by one, paying for the pharmacy bill, paying for the lab bill, doing the procedure bill and the billing sheet, then you can come straight to the grand total bill, where all the bills of the patient would have been put together, except for the consultation and registration fees, which they would have paid before even seeing the doctor. So everything else is included in the grand total bill. There's also the itemized bill. This shows the details of all the bills or the fees that the patient has to pay for. Sometimes you have a patient who wants to have the details of their hospital bills. Then you can come to the itemized bill and then select it and print it out for the patient. There is the cash out section. Here, as a cashier, you can click on this link to see your total sales for the day and then cash out. And then there's the price list. The price list is a list of prices for everything on the system. So you can verify prices if you think some prices are not correct.